Some people have just joined. There we go. Let them join and then we'll start. Okay. Lovely. Right, so welcome to the Birth Plan Workshop. I'm Leanne and I run Birthhood. I am recording this. I don't normally record them, but I am recording this. So if there's if you want to kind of ask any questions and feel like you want to do it personally or privately, feel free to kind of either send me a message through chat, or you can like DM me on social media. That's absolutely fine. But there was about 30 people that signed up for this, so we're a bit low on the numbers, so I thought I'd record it in case anyone didn't get the email with the login details. So obviously it's quite a short session, and obviously I'm doing these for free so people can get as much support and information for birth preparation that's accessible. And today's is birth planning. So we're looking at why do we do a birth plan, or preferences, however you want to call it. Where do people start with birth planning? Who to give it to, and when? Will people think I'm demanding because you put in what you'd like for your birth on there? Planning for your A, B, and C scenario, and does my partner get involved? So we're going to answer these questions, and we're going to talk through a kind of a plan that's already been done, so you can see how that works. So first question, why do a preference or a plan? And the basics of that is, if you haven't, the beauty of a birth plan is the preparation that goes into it. So it's you and your partner. So I'm going to tick off two in one here, but it's you and your partner making sure that you are on the same page. You know what you want for your birth, and there's so many options out there for your birth, and we're going to go through so you guys can plan specifically for what you want the outcome of your birth to be. Not necessarily the mode of birth or exact, but you can say, let's look at, you want pain relief, these are the ones we've already looked into, we know the pros and cons of these is what we agree to, instead of having someone coming in and telling you what they're going to do, because it is your choice. And you'll be knowledgeable of all your preferences. So if you've done your plan, you've got that. I always found clients that come to me that subsequent pregnancies have found that the birth planning process was the most important for them as they went into their second birth, because they handed over their control to their care providers when they didn't plan. Whereas now, because they have planned, they were able to kind of have those discussions, understand what was going on a little bit better. So it's really important to make sure you keep a little bit of control when you're giving birth and when you're preparing for birth. So where do you start with birth planning? The biggest thing is getting informed, because if you don't know your options, you're going to find it difficult to plan your birth. So doing some sort of antenatal classes, an online hypnobirthing, read the books, do a full hypnobirthing course is where you're going to be able to talk you through your plan in person. But anything where you can get information to physically get the information to plan your birth is where you want to start. And I'll go through, you can write your plan down on a piece of paper. It doesn't have to be typed up nice. But if you head to the website, the link I sent you, you can download the birth planning guide for free that you can do. And it's set up in little boxes, so you can write your specific things in each area, which is really handy. The key things I would always say is, where do you start? What is it that you particularly want for your birth? What is your non-negotiables, if you like, the things that you go, actually, this is what you've got to meet for me. And you start there, and then you kind of work your way through the different stages of labour, your placenta, what you'd like for your baby when in that golden hour. So you kind of go through that process. So we're going to do that together in a minute. Who do you give your birth plan to, and when? A lot of midwives like to talk you through your birth plan, but really they just want to know that you've actually had a thought about it. So around 36 weeks, they might ask for that conversation. So I always say, try and have one ready for then, so you can kind of go, yeah, I've done my plan, this is the sort of thing I'd like. But obviously you don't have to share it with them if you don't want to. But doing it with your birth partner is really, really important. And then you share your birth plan with your healthcare provider when you get there. It's one of the first things you will hand over. And if you see down here, it says planning A, B, and C. Depending on your scenario, you only give your A plan. The plan is the plan that you specifically would like to, it's like your ideal plan, and you give it to your midwife when you get there. Well, your birth partner gives it to your midwife, and you can highlight the key things that are really important. And that, again, is why it's really important that your birth partner's involved, so they know what you want. And then if your birth kind of starts to deviate a bit, and you either need an induction or some augmentation of labour, so anything to speed it up, if that's suggested to you, you can kind of refer to your B plan and go, yes, I want this, or no, I don't want this. Or if I do have this, this is what I'm going to agree to. And then your C plan is your cesarean. So I've had clients that have said to me in the past, well, why am I planning for a cesarean? I don't want a cesarean. And it's not that you're planning for it to have it, it's so that you've discussed your options and you know how to make it a much more birth-like scenario rather than something that a lot of people find really clinical. And you have options in the cesarean as well, which we're going to come to in a second. And then obviously, leading to your planning of your A, B, and C, it is important that you've thought about what you want depending on how birth kind of like changes, because birth can change for everybody. There's a number of reasons that will inhibit birth and cause you labour to stall. And for some, that could mean that you go into a panic. And if you go into a panic, you're more likely to need intervention. So it's really important that you are aware of, if it does deviate, what can you do about it? How do you keep some control? I don't know about any of you, but I'm like a huge control freak. So for me, planning that meant that whatever happened, I wouldn't look back with regrets or feel like I was didn't have any choices or pushed down into a path for birth that I didn't want to have. So I kept that control. And like I said, planning for a cesarean, I've had clients who have come to me from a previous cesarean and had a plan for a second cesarean. I had one client who then changed and had a vaginal birth, even though they booked a cesarean because they realised that they didn't need to have one, but they didn't have this explained. But the one that then have stayed with their cesarean route, they've kind of said the difference in their cesarean from the first to the second was huge, because they didn't realise that they could have delayed coil clamping, that baby could go on the chest, that they could have their music playing, that your birth partner could be there reading your affirmations, all these sort of things that they didn't realise could be happening. They got the second time round, and it transformed that experience for them. So it is important that you do plan and you know. And I'll stress this again, it's at the bottom of the list and I've talked about it already. Does my partner get involved? 100% yes. If your birth partner isn't kind of involved, then they become that bystander in your birth, because they don't know what your preferences are. If a healthcare provider walks in and starts chatting and you've said, I really don't want people to talk to me through labour, and they don't know that, then that takes you having a conversation with people to get that to stop. Whereas if your partner's done it with you and you've explained, this is what I don't want, blah, 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 they can kind of intervene and say, hold on a minute, this is in the birth plan, we don't want this, can you back off, or can we have a conversation about this if it's something a little bit more serious. So here is what the birth plan looks like that you can download. But I'm going to stop sharing this screen and I am going to share one that has been complete. So you're going to see my face for a moment, quite big, there we go. And you will then be able to see what this looks like. So this was a client, hopefully you can see this. And this was a home birth plan. I'm just going to scroll down at the bottom. You can see I've just taken out the names because I don't want to share that. And they had a doula as well. So that was their kind of like preference. So in here, in this box, you need to put the key things that you want your midwife to know. So anything specific relating to you and your pregnancy goes in here, or anything that is really, really important to you. So for this person, they've said, please be mindful of positive language. Midwife, please sit quietly and observe. No unnecessary communication. But you can listen to the baby every so often with permission. So that's with a Doppler. So it's the key things that they're likely to be asked quite quickly, that are things that the midwife's going to want to know about you and your birth very quickly, but it's already on there. It's the first thing they'll see, it's the first thing they'll read, so it's going to be really clear for them to know exactly what you want. The environment's important, and it's got its own box because your birth partner will be responsible for creating that environment. So again, there's a lot going on. The birth partner has a huge role. There's 5 pillars to a birth partner's role. And the kind of like the practical and the physical aspects of birth is one of them, and making the environment positive is that. And when you've got loads going on in your head, it's important that you've got something on there to remind them what the things are that you want, but equally your midwife to observe and know, so they're not coming in. If you've said I want a calm environment and low lighting, you've not got them come in and put the lights on all the time. So this client wanted calm, relaxing atmosphere, low lighting, speaking kept to a minimum but with soft voices, so no like going in like, right then, what's going on, kind of like nice and calm. Environment to be set up with electric tea lights, affirmations, aromatherapy, their hypnobirthing relaxations, dim lighting and music, and they want to be in the living room and the bathroom. So they made it clear the rooms that they were going to be kind of working in. And it was clear that then again the birth partner and the midwife team can work together to keep that environment as positive as possible. I realised I didn't talk a little bit about what to be demanding, and I'll explain that at the end, I think. As this is a home birth, you get access to most, if you attended the birth, the pain management workshop I did last month, I kind of discussed the kind of pharmaceutical pain relief options and then all the others. And there's actually only a few pharmaceutical ones, and there's only a couple, there's only really a epidural that you can only have in a hospital setting. All of the others you can have anywhere. So you have a lot of options for pain relief wherever you are, because obviously a lot of these you can take with you into a birth setting as well. The key thing for this client here was no offer of pain relief unless I request it. So just thinking about that, when I say to you something like, do you have any aches or pains today? You will probably do a body scan and kind of go, oh yeah, like I've got a bit of a niggle in my hip today. So you'll do that. Whereas if I say, are you comfortable? You're more likely to agree to being comfortable because of how I've proposed it. Obviously, if I say you're not more likely, you're going to say yes regardless of the question, because you do a body scan to search for it. But if you're searching for comfort, you're less likely to ask for pain relief when you're not ready. But if someone comes in and says, oh, you look like you're in a bit of pain, do you want some pain relief? You're likely to accept it, and which is fine unless you really don't want it or need it at that point. And then that means you've kind of like gone off your plan. So again, it's really important, and it was for me, that I didn't get offered it. I request it if I want it. Use of a birth pool, gas and air, which easy to have at home. Lots of use of movement, lower back massage, light touch massage, gas and air, she said twice. So clearly she wanted a bit of gas and air. But other things in there you would put depending on where you are. So you can have things like Pethidine at home, you just need a prescription. You can use a TENS machine, you can have aqua pressure, and you can have some counter pressure as well. So the use of a cone, there's loads of things that you can use in that pain relief options, but these were the ones that she was happy with. She clearly knew what she wanted, and that was there. Then we talk about monitoring. So monitoring is basically what your midwives are going to do when you're in labour to assess you. Now, first things first, you don't need any monitoring ever unless you want them, because your baby will progress and birth progresses without anyone kind of like monitoring, and some monitoring can lead to more negative outcomes than others. So it's important you know what you want. So again, that's why your knowledge is really important. Here, one of the key things that a lot of people ask and question me is about vaginal examination. So where the midwife will insert the fingers into your vagina to your cervix, and use their fingers to assess how dilated you are. But with this, a lot of people don't know that it's optional, and it completely is. You can decline it, accept it, decline, and then accept later, because it's just a snapshot in time. It doesn't suggest how long you're going to be in labour for, because it can progress at different rates. So this particular client did not want them unless they requested them, and any unforeseen circumstances discussed with the presence of the partner and doula, so they could have an open conversation. We wish to have alone time to process information without medical healthcare staff unless medical emergency. So when other things were coming in terms of the progress of labour, they wanted to be able to have some time together to process what was being discussed with them before they move forward. So that's put in here so they knew that when it comes to anything that's suggesting about how labour's progressing, the midwife knows their preferences. Coaching refers to when you are in your birthing phase and you are being told to push or not. Generally, you don't need anybody to tell you when to push. Your body will push for you. You don't need to engage any of the muscles, and this is where birth breathing comes in, because it's about directing your energy down and your breath downwards, but actually not pushing. And it's better you feel that kind of like contraction, the surge, and then you kind of go with it. Positive encouragement is good though, kind of like, yes, well done, you're amazing, keep going. That kind of stuff's great. But if they're kind of asking you to push, you've got no contraction, that can cause you to obviously fatigue, and it can also cause you to increase risk of tearing. So we need to be mindful about that. But again, that's completely your choice, what you would like. You might really appreciate someone telling you when to push and how to push. So again, it's really important that you have your preferences there for that. Birth positions is on there because a lot of people come to me after a first birth and say, I had to be on my back. They said I had to birth on my back. You don't have to do anything. So it's really important that you've thought about what positions you might feel comfortable with, but equally being as mobile as possible. That doesn't mean walking around. That means just letting your body move when you need to be. That's what's going to help aid your birth. Birth physiology and biomechanics, we know that you being upright, forward and open is the best position to get your baby, to create the space in your pelvis to get baby out. So again, like learning what positions those are is really important for you. So I suggest you go and have a look, and then how you could possibly be in that UFO position on a bed is good. So this client said, if I choose to be on a bed, headboard up so I can kneel backwards and use the support. So again, that's a really good one. I may wish to sit backwards on the toilet. I will tell you now, the toilet is the dilation station, and I lived for the toilet, just sat on there when I was in labour, purely for the fact that I could rest my head on a towel on the cistern, and I had nothing underneath, like my vulva, so the pressure was completely gone. So don't dismiss the toilet. Lots of movement this client wanted, and the use of a birth ball. So again, just letting them know what positions, and their job is to facilitate the birth that you want. So what's quite good, if you get them here and you know that they're reading it, and or if they say to you, come on, let's go to bed, let's get you lying down, and you know you don't want that, and your birth partner knows you don't want that, then you can say, look, we've said that in the birth plan, we need you to support what our preferences are. So you can use that to reinforce. Intervention, what you agree to in your A for intervention. So that can be anything from kind of suggesting things like forceps, or kind of anything that intervenes with your birth. So an augmentation of labour. It might be that transfer from home to hospital, anything. And it's not that you say you don't want anything, it's that you are agreeing if it's medically necessary, but you will have a discussion before you decide on any intervention, rather than anything just being told to you and you've done. You always want to make sure that you've used, and it is about time. So there's an acronym called BRAIN, which is really important, and the N stands for nothing. So what happens if I do nothing? And that's good for you to kind of have a think about what options you've actually got there, and then you can decide which intervention, if any, are relevant to you. So you put that there, and there's lots of interventions. It could be things including, once the baby's out, your injection to get the placenta out, that's an intervention. Giving you the drip to speed things up is an intervention, but a lot of people don't realise that's what they've had because they've not had that conversation. So making sure you are clear in what you agree to and what you don't agree to. Right, catching the baby. I put this on here specifically because I have a lot of clients who didn't realise that they were allowed to catch the baby. They thought the midwife gets it and gives it to you. Obviously, if you're standing up, your midwife will be crouching to catch the baby, because and help you guide, but you would then take the baby and guide the baby up. Particularly in water, the baby comes out and you'll be able to reach down and get the baby yourself. Or if you're on a bed on your hands and knees, they might kind of like guide the baby from underneath you towards you, but you the one that picks the baby up. So it's really your hands that are touching the baby first. It might be that you want your birth partner to catch the baby and bring the baby up, so you've got that joint connection there, which is really nice. But again, if you don't put that on there, they'll automatically do that for you. For me, I wanted my hands to be the first on my baby, so I made sure that that was there for me as well. Which then goes down to the third stage about birthing your placenta. So lots of people don't realise that you can have an injection or not. And it's, for here, they've said physiological third stage, which basically means they don't want anything to intervene with the birth of the placenta, let the placenta come in its own time. They'd have an active management where they use the injection, which is like a synthetic syntocinon, which helps the uterus to contract to stop any blood loss. So again, she said, if there's an emergency, I agree to that. But other than that, I want you to leave me alone. Optimal cord clamping is, and she's put wait for white unless absolutely necessary. And I've left the name in there, Paul, to cut the cord. So that's basically where the optimal cord clamping isn't where you delay cord clamping for like 2 to 3 minutes. It's where you wait for the cord to go white before you clamp it. The reason that is because a third of the baby's blood is in the cord. So therefore, if you clamp a cut straight away, you're depleting the baby of its own blood. The studies going into looking at the outcomes for that. The main thing that you want to be aware of is if your baby is having difficulty breathing, keeping the cord attached to them means they're still getting oxygen. So it's much better to wait to do that, so you know they're still getting that oxygen through that blood, the placenta and the cord blood. And yeah, who is it that you want to cut the cord? So a lot of partners like to do it. Sometimes the mum, the birthing person, wants to do it. Sometimes neither of you want to do it. But again, putting it on there, and particularly if you're looking at cesarean, your birth partner can still cut the cord. So again, making sure you're aware of that being one of your options and your rights. And in here, if you're planning to keep your placenta, you would put that here as well. So some people like to encapsulate it. Some people like to take it and bury it, or you might just want to have a look at it and then discard it. It's completely up to you, but you'd put that in here. And then a golden hour. So this is the initial 1 to 2 hours post-birth that you have with your baby, which is for you to soak up that newborn goodness. I have put on my social media a post up recently about what happens if you don't get that initial golden hour and why the golden hour is important. Go and have a read of that because it might help you. But there's things in here that's important. So skin to skin's amazing. It's great for bonding. It helps regulate the baby's heart rate, temperature, breathing rate, regulate their gut and their immune system. Helps initiate breastfeeding. So there's loads of benefits of this skin to skin. But if you don't get it immediately with you as the mum, then your birth partner can do that, and that's still beneficial. But if you don't get to do it immediately, you do it later, and it's still going to have a positive effect. Please do not clean the baby too much. It might have vernix on it, which is really good moisturizer. So you're saying you don't want to have that wiped off. It protects the skin. So again, do you want that off? Do you not? Have that conversation. At least 1 hour baby, and they want to have breastfeeding established before any weighing or measuring. Your baby's not going to weigh differently if you have it done straight away or at the end, and that bonding is more important than knowledge of that weighing. But again, that is your choice, so make sure you have your preferences in there. And in the golden hour, you'll look at your vitamin K, which is offered to everybody, and you can accept, decline, and you can have it in oral dose or an injection. This client went for an injection, which is given to the baby, but again, you can delay that. That doesn't have to be done till after that first hour with your baby. It's usually good to have that, if you're going to agree to the injection, to have it while they're on your chest. So again, they can calm down quite quickly, but you'll put all that thing in. So here's some key notes that she wanted. So if baby needs help breathing, I do not consent to you cutting the cord. I want baby to receive all blood and oxygen from the placenta. Resuscitate next to me unless absolutely necessary. So again, it's not that we want to like to think about that, but the baby, out of babies, around 5% need some help breathing, and of that 5%, only 5% need them more than just a back rub. So again, the likelihood is really low, but she wanted to make sure that her needs were met, even if that scenario happened. If you notice that I'm in transition, so that's going from kind of the up phase, so when you contract, your uterus contracting, your cervix is dilating and effacing, to your birthing phase when the baby's coming out, that transition period is called transition. Please remind me of this, positive encouragement and reassurance, because at that point you might start to go, oh, I want to go home, I can't do this anymore. So a reminder that they're nearly there and going to make baby soon is help to keep them calm and focused. So these are all the things that you need to talk. Now on that, what I've done, what's uploaded for you to have a look at is your like a little guide. So it goes through things that you're going to want to consider. Now, obviously, I mean, it doesn't go into all the details of what everything is and what you do and why you do it. This is just for you to think about for each kind of element. It's a bit of a guide for you to consider. And if you don't know what these things are, feel free to get in touch, whether that's you kind of going that way and go away and research it, join a course, whatever it is, but make sure you have considered these things. When it comes to induction, things change a little bit, so you can think about when and how you're going to have your induction, and that would include starting with a membrane sweep. Do you agree to that? You might be offered one for your ideal, so again, think about that. Why might be things like post-date, so it could be preeclampsia, it could be gestational diabetes, but again, making sure you agree to what your preferences are for when and how it happens and why. What do you think about what happens if your waters have gone prematurely and you've got 24 hours before you need to be induced? You don't have 24 hours, that's usually policy, you've got as long as you want. So again, what was your preferences for that? Yeah, and you kind of like go through so for example, forceps is more common with an induction because it's an artificial intervention and augmentation of labour. So it's really important that you have considered a forceps birth and whether you'd like one or not, what the risks are for you and the baby, and made that quite clear in your plan, so that and obviously understanding how to promote your labour to progress without that intervention and augmentation is really important. And then your cesarean birth preferences is looking at the difference between emergency versus unplanned. So sometimes birth becomes an emergency, and if baby is in that state, you will be in and out of in surgery within kind of like 15-20 minutes. So you are literally having the baby out really quickly. Unplanned means you probably wait about 45 minutes to an hour, but a lot of people think that this is kind of an emergency. So if labour stalls, for example, or we need a cesarean, that's classed as an unplanned one. If it's emergencies you're in straight away, and it's called a category 1, often under general, that's really what an emergency is. But with an unplanned, you can still have lots of your preferences met. Emergency is more difficult, but your birth partner can say, look, it's really important that this happens. So again, that's why your birth partner's involvement is what is important. But these are the things that you can have in a birth. So again, thinking about what you would like, how you want that birth, the cesarean birth, to go, what can your birth partner do, what music you're going to have playing, lighting, which sounds silly, but you can have the lights a bit lower your end. They can just have the lights on when they're doing like bright, when they're actually doing the surgery, and then they can dim it a little bit your end so it's not quite as like bright in your face. Having your music or your scripts playing. Partner can do lots of affirmations, touch, cuddles. You can read, you can describe what's happening in the birth if you feel confident watching. You can still do your birth breathing to keep you calm, reduce your anxiety. It's less likely to give you a stress response, which is good. Things like having the curtain lowered so you can see the baby being brought up, and then the baby goes straight onto you, and you can have your gown on backwards, for example, to allow you to get the baby straight on there. So again, thinking about that, and still having cord clamping, optimal cord clamping. So rather than doing it straight away, you'll see that a lot of cesarean births, you'll see that when the cord is cut, it's quite blue, whereas actually you can wait and get the placenta out, put the placenta in a pot beside you, and you can wait for the cord to go white so you know that baby's getting it. Worst case kind of scenario for that, you just ask them to wait for 2 to 3 minutes so you know that they're getting as much of that positive blood flow and oxygen to them as possible. So that is my half an hour whistle stop tour of birth planning. And one of the points I made at the start was, what do you kind of like, am I demanding and that kind of thing? You're absolutely not demanding. This is your birth. You get to birth this baby once and once only. And it's really important that how you feel is really important when you come away from your birth. And if you feel like you've got control, if you feel calm and you feel like you've had your needs met, and you feel listened to, your experience of birth is so much more positive than those that come out and feel that they weren't listened to, that their preferences weren't met at all, or things were done to you without your consent. And I think that control element and that feeling of being supported is what makes you feel, and feeling safe is what makes you feel positive about your birth. And it does start with that birth planning. And like I said, the main reason is because you know your options, you know what you want and what you don't want, and your birth partner can help intervene and stop anything that you might not want at that time. So I'm just going to stop sharing at the moment, and we've got a little bit of time for question and answer if any of you have got anything you would like to ask. Otherwise, you are free to go, and I thank you very much. Any feedback as well would be greatly received on social media, or an email. That'd be great. Any questions from anybody?
Thank you. I was just going to ask, on the transition phase,